Hello everyone, now let us discuss about 2023 ICT NCM coding guidelines for chapter 21 part 1. Chapter 21 mainly deals with factors influencing health status and contact with health services. The chapter specific guidelines provide additional information about the use of Z codes. Chapter 21 mainly deals with the use of Z codes for specified encounters. In chapter 21, there are mainly three areas. The first one is use of Z codes in any healthcare setting. The next is Z codes indicate a reason for an encounter and provide additional information about the patient encounter. And finally, coming to categories of Z codes. There are various categories for Z codes and we will discuss each code in detail about each category of Z code. Now, coming to use of Z codes in any healthcare setting. Z codes are for use in any healthcare setting and they may be used as either first listed, that is nothing but principal diagnosis, or as secondary code depending upon the circumstances of the encounter. They can be used as PDX or SDX depending upon the circumstance for the encounter. And certain Z codes may be used only as first listed or principal diagnosis. Let us see one example, and in the further sessions we will discuss about all the Z codes that can be used as first listed or principal diagnosis. Now let us see examples. First, Z codes that can be used as only PDX. The first example is a 26-year-old pregnant woman presents for termination of pregnancy. Here the PDX is Z33.2, that is nothing but encounter for elective termination of pregnancy. Let us see one more example. A 35-year-old woman suffering from left breast cancer presents for radiation therapy. Here the PDX is Z51.0, encounter for anti-neoplastic radiation therapy, followed by C50.912, that is the code for malignant neoplasm of left breast, malignant neoplasm of unspecified site of left female breast. So here are the examples of Z codes that can be used as PDX only. And in the further sessions, we will have an entire list of codes that can be used only as PDX that we will discuss in the further sessions. Coming to next point, Z codes indicate a reason for encounter. Certain Z codes, they indicate the reason for encounter and provide additional information about the patient's encounter. So Z codes are not procedure codes and the corresponding procedure codes must accompany a Z code to describe any procedure performed. Now let us see an example. A 5-year-old child presents for well child visit. Immunizations are due but the parent refuses to administer the vaccine. Here patient presents for wellness visit. That is given by Z00.129, encounter for routine child health examination without abnormal finding. Then next, here immunization is not carried out because of the refusal of the caregiver. So the appropriate code is Z28.82, immunization not carried out because of caregiver's refusal. Here our Z code is giving the additional information regarding the encounter or regarding the procedure, whether the vaccination is carried out or not is given by this code. Here, according to this code, vaccination is not carried out because caregiver has refused to administer the vaccine for child. So Z codes, they provide an additional information regarding the patient encounter. Now coming to categories of Z codes. There are various categories of Z codes and we will discuss about each category specifically in the further sessions. In the current session, we will be focusing on contact and exposure, Z codes regarding the contact and exposure and inoculations and vaccinations. Additional to that, there are Z codes regarding the status, history, screening, observation, aftercare, follow-up, donor, counseling, encounter for obstetrical and reproductive services, newborn and infant services, routine and administrative examinations, miscellaneous Z codes, non-specific Z codes, and Z codes that can only be principal or first listed diagnosis, and finally social determinants of health. These are the various categories of Z codes that we will discuss. Now coming to the first category, that is contact and exposure. In that we will be discussing about two subcategories, Z20 and Z77. Coming to Z20, it indicates contact with and suspected exposure to communicable diseases. These codes are for patients who are suspected to have been exposed to a disease by close personal contact with an infected individual or are in the area where a disease is epidemic. The next is Z77. It deals with other contact with and suspected exposures hazardous to health. Now, coming to contact and exposure codes, they may be used as first listed codes to explain an encounter for testing or more commonly as secondary codes to identify the potential risks. They can be used as both PDX and SDX. Majority of the cases, they are used as secondary codes to identify the potential risks. In some cases, they are used as first listed codes to explain an encounter for testing. For example, if a person presents for screening of HIV, encounter for testing of HIV, and the person is suspected to be in contact with. So in that case, Z20 series can be used as PDX because the reason for encounter is testing itself. As we have discussed earlier, Z20 deals with contact with and suspected exposure to communicable diseases, whereas Z77 deals with other contact and suspected exposures to hazardous to health. Now coming to various codes of Z20 category. The first code is Z20.01. It deals with contact with and suspected exposure to intestinal infectious diseases due to E. coli. Next is Z20.09, contact with and suspected exposure to other intestinal diseases. The next is Z20.1, contact with and suspected exposure to tuberculosis. The next is Z20.2, contact with and suspected exposure to infections with a predominantly sexual mode of transmission. The next is Z20.3, contact with and suspected exposure to rabies. Next is Z20.4, contact with and suspected exposure to rubella. The next is Z20.5, contact with and suspected exposure to viral hepatitis. The next is Z20.6, contact with and suspected exposure to human immunodeficiency virus HIV. The next is Z20.7, contact with and suspected exposure to pediculosis, acariasis and other infestations. The next is Z20.810, contact with and suspected exposure to anthrax. Z20.811 deals with contact with and suspected exposure to meningococcus. Next is Z20.818, contact with and suspected exposure to other bacterial communicable diseases. The next is Z20.820, contact with and suspected exposure to varicella. Next is Z20.821, contact with and suspected exposure to Zika virus. The next is Z20.822, contact with and suspected exposure to COVID or SARS-CoV-2. SARS-CoV-2. Next is Z20.828, contact with and suspected exposure to other viral communicable diseases. Next is Z20.89, contact with and suspected exposure to other communicable diseases. And finally Z20.9, which deals with contact with and suspected exposure to unspecified communicable disease. These are the various codes that come under the category Z20. Now let us see an example. Patient presents with cough and fever and the patient's spouse was tested positive for COVID 3 days ago and COVID test has been ordered for the patient. Here, patient is not diagnosed with COVID. He is having symptoms and he has contact with and suspected exposure to COVID-19 because his spouse was tested positive. So the first code is R05.9, that is cough unspecified. Next, fever R50.9, fever unspecified. Next is Z20.822, contact with and suspected exposure to COVID-19 or contact with and suspected exposure to SARS-CoV-2 because patient has been suspected to be in contact with the COVID patient. Now coming to next category, that is Z77. The first code is Z77.010, contact with and suspected exposure to arsenic. The next is Z77.011, contact with and suspected exposure to lead. Next is Z77.012, contact with and suspected exposure to uranium. The next is Z77.018, contact with and suspected exposure to other hazardous materials or exposure to chromium compounds or exposure to other nickel dust. In all these cases, you need to code Z77.018. The next is Z77.020, contact with and suspected exposure to aromatic amines. The next is Z77.021, contact with and suspected exposure to benzene. The next code is Z77.028, contact with and suspected exposure to other hazardous aromatic compounds or aromatic disenoids or polyacrylic aromatic hydrocarbons. In all these cases, you need to code Z77.028. The next is Z77.090, contact with and suspected exposure to asbestos. The next is Z77.098, contact with and suspected exposure to other hazardous, chiefly non-medical chemicals. For example, disenoids. Next is Z77.110, contact with and suspected exposure to air pollution. The next is Z77.111, contact with and suspected exposure to water pollution. The next is Z77.112, contact with and suspected exposure to soil pollution. The next is Z77.118, contact with and suspected exposure to other environmental pollution. The next is Z77.120, contact with and suspected exposure to mold that is toxic. The next is Z77.121, contact with and suspected exposure to harmful algae or algae toxins, algae and algae bloom, blue-green algae bloom, brown tide, cyanobacteria bloom, fluoride red tile, simply red tile or Fistracia pisidia. In all these, whenever the physician documents any of the below listed terms, you need to code Z77.121. The next is Z77.122, contact with and suspected exposure to noise. The next is Z77.123, contact with and suspected exposure to random and other naturally occurring radiation. The next is Z77.128, contact with and suspected exposure to other hazards in the physical environment. The next code is Z77.21, contact with and suspected exposure to potentially hazardous body fluids. The next is Z77.22, contact with and suspected exposure to environmental tobacco smoke, acute or chronic, or exposure to second-hand tobacco smoke, acute or chronic, or passive smoking, acute or chronic. In all these cases, you need to report Z77.2. Next is Z77.29, contact with and suspected exposure to other hazardous substances. Finally, Z77.9, other contact with and suspected exposures hazardous to health. Now let us see an example. A 36-year-old woman presents for treatment of COPD. Patient is a chronic everyday smoker. Patient has been exposed to environmental tobacco smoke for quite long. So here the PDX would be J44.9. chronic obstructive pulmonary disease unspecified. Under this code in the table or list, you will find use additional code to identify suspected exposure to environmental tobacco smoke, that is Z77.22. So additionally we need to code this code also, Z77.22, to indicate contact with and suspected exposure to environmental tobacco smoke, acute or chronic. Now coming to second category of Z codes, inoculations and vaccines. The code Z23, this is the only code. Z23 is for the encounters for inoculations and vaccination. Whatever might be the vaccination, the ICD is Z23. It indicates that a patient is being seen to receive a prophylactic inoculation against a disease. The procedure codes are required to identify the actual injection and the type of immunization given. Whenever we are coding vaccines that we have discussed in the medicine chapter, you need to code two codes, one for administration and the other is the product code. So the procedure codes are required to identify actual administration of the injection and the type of immunizations given. And code Z23 may be used as secondary diagnosis if the inoculation is given as a routine part of preventive health care such as well baby visit. Here the PDX would be well child visit, then followed by Z23. Now let us see an example. A 5-year-old child presents for general annual checkup, that is well child visit. MMR vaccine is administered. And here MMR vaccine is administered. So first the PDX would be Z00.129. Encounter for routine or general child medical examination without abnormal finding. And then followed by Z23. That is nothing but encounter for immunization. Coming to the CPTs, first you need to code preventive medicine CPT, that is 99393. Here the patient is an established patient along with 25 modifier. 393 indicates preventive visit for established patient, late childhood, that is 5 to 11 years. Here the age is 5 years. So 99393 followed by two codes for vaccine. The first is the admin code 90471, immunization administration including percutaneous, intradermal, subcutaneous or intramuscular injections. Here we have given a subcutaneous injection. For subcutaneous, percutaneous, intradermal and intramuscular, admin code is this only 90471, followed by product code, that is MMR vaccine code 90707, measles, mumps and rubella virus vaccine, live for subcutaneous use. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.